Hello, everybody. Good afternoon, and welcome once again to our weekly COVID-19 public health update with Montgomery County Executive Marc Elrich. I'm Lorna Vigilla, Hispanic Public Information Officer for Montgomery County Government. And joining us today is Dr. James Bridgers, our Acting Health Officer, as well as Dr. Earl Stoddard, who is the Assistant Chief Administrative Officer. Mr. County Executive, your turn. Good afternoon.
Good afternoon, and thanks for joining us again for our weekly briefing. And I'm sorry, a little late this morning. This has been a concerning morning with the bomb threat activity. I'm sure you're all aware of it. Walter Reed. At this moment, this is a federal response, but county public safety resources are on standby to assist if it's necessary. In better news, on top of the front page of yesterday's Baltimore Sun was the headline that the county had reached 99.9% of the eligible population receiving at least one dose of the vaccine, according to the CDC. This is a remarkable achievement and a testament to how serious this community has taken battling this virus. And from those who were first in line to get this vaccine to those who waited a few months, nearly every eligible resident has trusted the science and took the vaccine, and they understood its importance. I really want to thank everybody, as I always do, for what you've done to contribute to the high vaccination rates in this county. Our high vaccination rate is helping to drive our case rates lower, which are amongst the lowest in the region, as well as one of the lowest among large jurisdictions in the country. But our work is far from over. We're now ramping up for boosters and also for vaccinating our children. We are preparing to vaccinate over 100,000 younger children once they are approved for vaccination, which we expect to come within a week or so. We're committed to making sure our operations and outreach continue to expand, utilizing the good ideas that we've seen succeed while innovating new approaches. We know that the state's going to be taking a slightly different approach to this. They're not anticipating max vaccination sites, and they're going to be relying a lot more on pediatricians and local health delivery, but the county will still play a significant role in this. At this point, the folks who aren't vaccinated may be very entrenched in their refusal to take the vaccine, but we're not going to give up on trying to get through to them. We know that there may be some that got their first shot but didn't get their second, and we are working to make sure and remind them to come back and get their second vaccine. On our COVID case rates, today the positivity rate is 1.61, and we have a case rate of 7.46 per 100,000 K. We continue to be a community with substantial transmission, according to the CDC, and in that case, our indoor mask rate will continue. We're likely to be in the moderate range pretty soon. I won't say when, because I don't know, but the way things are trending, it could come pretty soon. Once we remain in the moderate transmission category for 7 days straight, our current indoor mask mandate will end. But again, so there's no confusion, we need to be in the moderate transmission for 7 days in a row. If we hit moderate for 3 days and it goes back to substantial, then the clock starts again. All that said, I think we'll be better off if people continue to stay masked when they're in close quarters and likely to be in contact with others, whatever happens with the mask mandate. We still have unvaccinated residents and people traveling into the county from surrounding areas that do not have the low case rates we do or the vaccination rates that we do. So in a cosmopolitan, metropolitan area like this, a high vaccination rate in Montgomery County doesn't mean that on a day-to-day basis, when you're at work or when you're shopping or in a restaurant, that everybody in those establishments is from Montgomery County, and everybody in those establishments is as vaccinated as the folks in Montgomery County are. We're not an island. So even when our mask mandate is removed, I'd continue to encourage safe masking indoors. As you can see by these maps from yesterday's state report, we are comparing to other jurisdictions around the state where many have case rates that are double, triple, and even quadruple our case rates. These numbers were, the numbers on the previous slide were, I guess, from yesterday. Our numbers actually lower than that today, but it gives you an idea of where we stand with the rest of the region. And this map shows a chunk of the East Coast, basically Pennsylvania, New Jersey, down to North Carolina. And you can see this cluster of orange counties, and we're in the middle of that, right above DC. And yeah, that cursor's getting there. And so we're this finger of orangeness amidst all this. We're likely to fall into moderate, like I said, pretty soon. But you can see what the rest of the East Coast looks like, and it's really not a pretty picture. Halloween guidance. Our case rates and vaccination levels means that our Halloween celebrations this year can be had with much less anxiety and worry as compared to last year. It doesn't mean we should all go to Halloween parties unmasked. Maybe we need to wear another mask over our COVID mask, but this is not the time to just say nothing matters. We want everyone to have a safe and fun Halloween, but we also need to continue to be smart about what we do. Last week, our Health and Human Services Department put out tips for celebrating a healthy Halloween, and I hope everyone shares them and adheres to this advice. On the employee vaccine mandate, which I know is a hot topic for everyone, in response to yesterday's employee vaccine mandate legislation, I think it became clear that the be vaxxed or get axed legislation is not quite as simple and maybe not as practical as some people think. And as I've been trying to say over the past month, do I want every employee vaccinated? Absolutely. And as do our employee unions, which are actually encouraging their folks to both report and get vaccinated. Frankly, they have no more ability to force vaccination or force people to report than I have. Right now, we're asking people to give us the information. But 83% of our employees who've reported are vaccinated. And that's a pretty substantial number. We also don't want to jeopardize our ability to respond to public safety emergencies or to have our jail understaffed. While I believe that a mandate would drive more vaccinations, the compliance rates that are likely could still leave us short of having adequate staffing. Last week, I received the reports I asked for from Fire and Rescue, the Police Department, and our Corrections Department that assess the operational risks and potential impacts associated with terminations, retirements, and transfers that could occur following execution of the legislation the way it's written right now. Dr. Starter went over these numbers in his testimony yesterday in front of the council, but I thought it was important to repeat the data again today. For MCFRS, the inaction of this mandate could lead to about 100 uniformed employees and 100 volunteer service providers possibly being lost. That is far more than 2%. And just a net reduction of 2% or higher would result in increased response times that could not be addressed long-term via shift changes, forced holds, and overtime. I hope everybody appreciates the irony that the people who would lose vacations, who would be forced to work overtime, forced to change shifts, and all these other things that will disrupt their lives are the people who are vaccinated. So the people who follow our guidance would be some of the people who are most affected by what we're going to need to do to adjust to shortages. As few as 10 to 12 members lost would begin to cause operational changes. Depending where they are, the operational changes could be more severe. And while we're in the midst of completing a new recruit training, they will be replacing people lost prior to this decision, and it will take at least 6 months to a year to recruit and train people to replace these losses. The Department of Correction and Rehabilitation could lose over 125 employees. There are 28 vacant positions already or people in non-work status. If only 50% of the unreported persons did not comply with the mandate, post-staffing would be reduced from 2 people to 1, visiting programs would be canceled, leave would be denied, among other impacts. The issues could be exacerbated as staff losses occurred in the correctional nursing staff. The police department might have to let go of as many as 280 sworn officers and 110 professional staff. MCPD assesses the mandate that could the mandate can reduce its capability to meet the minimum staffing requirements within district stations, and recruitment and replacement of staff would take another 18 months. Overtime would not be sustainable for staffing that deficit over 18 months. And recruitment has been a problem for several years. It's a hard job to do without the respect and support of the public, and it doesn't help that Montgomery County is among the lowest paid jurisdictions when it comes to police pay. It was fascinating to listen to Councilmember Hucker yesterday accuse me of hiding behind police shortages, which he thinks I should have addressed, which when we actually tried to address it by submitting a package of pay increases for our low-paid police officers to raise their pay to make it more competitive with surrounding jurisdictions, the council actually voted against it. So we've tried to address this. We have not had council support up to now in addressing it. If there's a change in heart on the council to address this problem, that's good news. Unfortunately, it doesn't come fast enough to address the problem that we're facing right now. It's a frustrating position to be in. If I could snap my fingers and get every single employee to get their shot, I would. I do not understand why people are not getting vaccinated. I do not know how people are going to look at the data and see who gets sick and frankly, who dies and how much of that is related to people who are not vaccinated. So it is unfortunate that so much misinformation continues to be out there. It is very hard to get space inside of some of the echo chambers where people are getting false information. And it's causing a problem, not just in this county, but around the country. I took an oath to protect the health, safety, and welfare of the residents of the county, and it would not be responsible to not consider threats to public safety in making a decision like this. I hope we can work with council members on a strategy that maximizes vaccinations without creating a serious public safety shortage. Again, I wish that the sponsors of the bill had sat down and said, what do we need to do next? And discussed mandates and how we could work out mandates rather than making it public, putting forward a bill, and then trying to figure out how to cope with the consequences. If I had submitted a bill like that, I would have wanted to know what was going to happen in the public safety departments and then tried to come up with a strategy that minimized the negative impacts. I've looked at other jurisdictions, Seattle being one of them, that's on one hand are facing very low resignations, but you need to look more closely at their numbers. In those jurisdictions like Seattle, the number of vaccinated employees is about 91%. They're allowing religious exemptions, a rather amazing number of religious exemptions. And so if people are content having 9 or 10% of the workforce working unvaccinated because they use religious exemptions, you got to wonder how effective this is going to be if this is really the crisis that it's being made out to be. So I'm not sure that we get to zero without not having a religious exemption. And if we have religious exemptions, we're still going to have people who are working unvaccinated. So it doesn't completely solve the problem of not having unvaccinated employees. We must go beyond political games being played here, and we need to come up with some serious solutions and not just say, well, I don't believe the numbers are right, because what if the numbers are right? It's going to be hard to bring people back after we fire them. Let's be clear, we've been ahead on every element of this pandemic. We follow the science, and you can look at our vaccine rate amongst our public and our employees, and they are largely vaccinated. Again, I dearly wish we could work this through so that we're sure that whatever decision we make, we're also able to make sure that the ambulances run on time, the jail's adequately staffed, and the police are able to respond. Our government employee testing would have been established by now, but we made a decision to pivot and channel our very limited resources to ensuring that our schools are safe. If you recall, at the beginning of the year, we actually drew heavily on the school system and the rest of our health system in order to provide both places and personnel to do the vaccinations we needed in the county. As we are back in school now, that personnel is no longer available to do vaccinations, and we already have an overstretched public health force in the school system that is both trying to manage the normal duties of operating the health department in a school, as well as the duties of dealing with COVID in the schools. So we are more stretched than ever. We're trying to find more employees than ever to bring into the schools to help the staff there deal with their now dual responsibilities of the general health of the students and the testing of the students. So we don't have the resources. And in many of the areas where we need the resources, there are frankly staff shortages all over the country. A lot of these positions just don't have the people around now to fill them. Our goal was to make sure that students were in school learning and reduce the numbers on quarantine. And the good news is that our approach has worked, and we successfully stood up a testing program that reduced the number of quarantine students. We went very rapidly from the 17 to 1,800 students who were being quarantined in the first weeks to currently 356. We are also finalizing our Test to Stay program that Dr. Stoddard will update you on a little bit later. And MCPS launched a dashboard that more clearly tracks these numbers. And I want to thank MCPS, HHS, and our COVID response teams for their quick adaptation and quick work. We'll include this dashboard in the chat in case you haven't seen it yet. And this is the website is available here. When schools weren't open last year, we did have the benefit of all that personnel. But as I said before, we don't have it now. We're still testing 5,000 people per week as part of our efforts to keep infections down in communities, and the numbers don't lie. We're making the right decision with the limited resources that we have right now. Final thing I want to say is it's bittersweet to have read this week that Nancy Kopp is retiring as our state's treasurer. For over 5 decades, she served the state of Maryland and Montgomery County with grace and honesty, while remaining true to her convictions and always standing up to powerful special interests on behalf of the voiceless. She was not only a trailblazing pioneer for women throughout her service to Maryland, but she's been an innovator as both a legislator and a treasurer. Her leadership helped our state to become one of the best in the nation. I'm thankful for her counsel and friendship, and I wish her the best during her well-deserved retirement. And with that, I'll turn this over to Dr. Bridgers and Dr. Stoddard for their updates.
Good afternoon, all. Happy to provide a public health update again. As Mr. Elrich indicated, our numbers are trending in the right direction. Our case rate is still in a substantial community level transmission category, but we are moving in the right direction. Just some quick numbers on our 4-week case count total that our epi and surveillance team monitors. So over the past 4 weeks, we've had 2,345 cases. Of those 2,345 cases, there were 107 hospitalizations, which is about 5% of that case count. Our hospitalizations, we're still seeing, based on our hospital data and our surveillance data, that most of those hospitalizations occur in the 60 to 80 plus range. That's about 94.5 cases per 100,000. And the racial ethnic group hardest hit for those cases over the past 4 weeks are the Black non-Hispanic, which has the highest case rate of 234.2 cases per 100,000. Of those 2,345 cases, we had about 956 breakthrough cases, which is about 0.4%, 0.40%. 42 of those cases were hospitalized, and we see individuals, those age cohort, where we see most of those breakthrough cases occurring in our age group between 30 and 59-year-olds. Again, looking at the hospital COVID data, our ICU beds have decreased since last Thursday. There's been a decrease from our daily count of 21 beds. Our acute care beds have also decreased by 22 in number. So we are monitoring all of those cases that are COVID related, flu-like related, or pediatric in nature. Lastly, we continue to work with our community partners, Montgomery County Public Schools, as well as our private school partners to identify spaces, as well as our physician primary pediatric providers to identify those spaces where we will vaccinate those pediatric populations. But keep in mind, in anticipation of the Moderna and Johnson & Johnson vaccine being approved in the next week or so, we've fortuitously expanded our sites to larger sites so that we can handle those large throughputs. Most of our community local health department doses were the Moderna doses. So we're accommodating and planning for that volume. But keep in mind, we have over 215 spaces in the county that are now administering those third shots for those individuals who are immunocompromised, as well as those booster shots for those individuals who are eligible. We will continue to refine our contingency plans to include those providers, those MCPS cluster sites where we will host vaccine pods to include those individuals who are in our school-based health and wellness center. We haven't received guidance from the Maryland Department of Health as yet, but we continue to plan nevertheless so that we are ready to administer those doses. Our anticipated vaccination schedule for our pediatric population, those 5 to 11-year-olds who will be eligible once a vaccine is approved, is around the first or second week of November. I'll stop there, subject to any additional questions.
Good afternoon. I have just a couple additional updates. As the county executive alluded to, we're currently working still with MCPS on our test to stay protocol. What our intention is we have a meeting with them tomorrow to talk through what we believe should be the final details, and we'll hopefully have some additional information about a launch timeline thereafter. We'll also be sharing hopefully tomorrow a version of our protocol that we've utilized with MCPS, but making it more broader in nature and sharing it with our non-public schools so that they may consider and then submit a strategy to implement test to stay at their respective locations should they choose to do so. So we should be sharing that with the non-public schools hopefully tomorrow, and then they can submit to protocols that they wish to utilize with a test to stay program in their individual schools. And again, we'll hopefully be working through the final details with Montgomery County Public Schools on the test to stay tomorrow and be able to talk more about a timeline thereafter. And when I say timeline, I think we're talking a pretty imminent timeline, assuming everything can be worked out tomorrow. So we obviously been working to bring in additional staffing, as Dr. Bridgers alluded to, and obviously that has allowed us to be in the place to do test to stay, and will allow us to ultimately do the vaccinations of the 5 to 11-year-old population. Obviously, we have, just so it's clear, we've had to put in our request for how many vaccines we're going to get to the state. We've asked for the maximum amount that we're allowed to ask for. And so that will obviously drive how many vaccinations that the county can do itself, recognizing that, as the president laid out in his plan this morning, the counties will not just be the only source of vaccinations for 5 to 11-year-olds. They will be sending vaccine doses to pediatricians, hospitals, and other healthcare settings as well. For the vaccine. So we won't be the only game in town, but we certainly know that we'll be one of the bigger games in town, and we'll obviously be focusing a lot of our energy on addressing those people who don't have access to a pediatrician, who don't have access or have underlying health conditions, things like that. So we'll have be laying out our strategy for the Board of Health on Tuesday, and look forward to talking more about it next week once we have a little bit more detail from the state. So I think I'll stop there.
Thank you, Dr. Stoddard. Thank you, gentlemen, for those opening remarks. Members of the media, the Public Safety Risk Assessment Report is on the chat in case you want to download that. And let's get started with the Q&A portion of the presentation. First, Dominique Maria Bonesi, WAMU, questions for the county executive. Good afternoon, Dominique.
Thank you, Lorna. Hi, Mr. County Executive. I had a quick question regarding last Friday, the governor allocated, I think, I can't remember the amount, but millions of dollars essentially toward police departments in each county. He said the allocation would be by population in the county. Montgomery County is the most populated in the state. I'm just wondering, one, will the county be accepting this money? I mean, from the state, did you have a choice? And then two, what might that money go toward? I don't know what sort of stipulations that money might come with, but I'm just curious to know. I know the county has put efforts forward to reduce positions in the police department. I just wondered what your thoughts were on that announcement last week.
Well, apparently that money could be used, I think, for pay, for equipment, and for training. So I am absolutely for sure going to make an application for our share of that money, because as I noted in my earlier comments, we are behind other folks in pay. This would give us hopefully some resources to close that gap. we need to do substantial retraining, and that comes with costs. And so the money would be more than welcome in terms of training. And there's some equipment that we need to buy that would, I think, improve some of our responses. So I can think of 3 categories that I could get into in a heartbeat. And that's without even sitting down with the chief and saying, what would you like to do? I know what I could see doing pretty quickly. So we will get an application in.
May I ask what sort of equipment that is?
Well, there's some portable shields that I know our sheriff department has that we don't use right now, would put officers in a safer position so that they could actually deal with suspects or people with guns, or they think have guns, who are in, say, a protected place, and not put themselves out vulnerable and exposed. That if you're not exposed and you're not worried about being shot, it changes the calculus of how you have to respond to a threat in the moment. That's one of the pieces of equipment. There's another tool, different from the darts that we use, but it's another tool that would disable somebody without causing permanent harm, that may be more effective and more effective at a longer range. The police department's actually looking at that. So there are other things that would really, I think, improve our response and give us better options in how we respond to people.
And I'm sorry, I'm just trying to understand. I mean, this is something that Democrats last week were furious with Hogan for saying that, that counties had defunded police, and that his refunding of police was only sort of going against the police reforms that were in place last year. Do you have any additional thoughts on that?
Yeah, look, I don't like the rhetoric, because the stuff he's offering is money we could have used, whether, the word defunding had ever been used by somebody or not. I've never talked about defunding. We look to make strategic changes in the police force, but we're trying to address the needs in the community because we think we need to do them anyway. But if somebody's going to offer me money for training, pay, and equipment, I wish he used different rhetoric, but we can certainly use the money, and I'm happy to try to get some.
Can I add real quickly to this?
Yeah.
I've been involved in the Reimagining Public Safety Implementation Committee, and the conversation I have with the police department on a regular basis is, we need to increase, there's this defund the police is often focused on, it's been sort of politicized, but really we can do transparency and efficiency within the police department and still provide appropriate public safety. And I think that's the thing that the county executive is alluding to, is that we can do both, and more resources to do both of those things is never going to be a bad thing. So frankly, if we use some of the funding for equipment, like more body-worn cameras or things like that, those both increase accountability and performance. And so I think the rhetoric, as the county executive said, is the thing that everyone focuses on, but that doesn't necessarily mean that we can't do things better and more transparently. And if the government wants to provide more resources to do both of those things, I've got a list that I work with the police department on all the time of things that we could do better, or we use those resources to do better.
Thank you. Thank you, Dominique. Next question is coming from Steve Bonnell, Bethesda Beat. Good afternoon, Steve.
Good afternoon, everyone. Kind of getting back to the mask mandate that's in place. I know when this was initially being proposed in early August, I think was the time frame that I was looking at and asking kind of, obviously we can look at the per 100,000 population in terms of case rates, but I kind of wrote the time hearing, 75 cases a day for 7 days, or I think the total is 525 over a 7-day average. And I just want to clarify that just looking at the raw numbers, that's what we're still looking at in terms of when this mandate would drop.
We are not moving the goalposts. Same goalpost.
Okay. So, and I just want to clarify, so that's still it. And also just, there's no vote that's needed, as soon as we hit those 7 days,
automatic.
And last question, technical question. To prevent the yo-yo effect, I remember at the time of the debate when the Board of Health was looking at this, do we need, if we hit that target, the mask mandate drops, is it 7 consecutive days of substantial transmission, or is it just 1 day, or was it different?
Seven consecutive days, correct.
Of moderate
Okay.
transmission, right?
Okay. I just want to clarify that that's pretty much all I have, actually. So good to hear that I'm following this correctly. Thank you.
So functionally, the way this will work, Steve, just to describe to you is, and this is the way it worked when it was activated. So typically now Dr. Bridges, then Dr. Gales would send a notice to the county council. We'd say it publicly that today is the first day of moderate transmission. And then we'll track, on our website that as we progress through. And then on the 7th or after when the 7th day arrives, then Dr. Bridges again would send another notice to the county council saying we've reached day 7. Therefore, at this time tomorrow, the mask mandate will be lifted. That's how it will work.
Yeah,
I think too. Sorry, go ahead, Doctor.
Go ahead.
No, I was going to say that, there's 2 metrics we're following, obviously the case rates and then also the positivity rate. And my understanding is, positivity rate, we've been under that for a while. It's just the case rates we're looking at. Am I understanding that correctly?
Yep, that's correct. Steve, the only thing I wanted to add, that Dr. Stoddard and I talked about this morning, and we advised the county executive that while we're monitoring these case rates and transmission rates, that when we get below that threshold, if there's a day in that 7-day consecutive period where the case count goes up, that restarts the clock.
But we're pretty, I've been monitoring it. If trends hold true, we're within the next week or so, we could be seeing that drop. Is that safe to say? Or
I believe I did the math this morning. You should certainly check my math. But I believe if we have 76 or fewer cases tomorrow, we would hit moderate for the first time. Like you can just figure out if you plotted each day's, add up the totals for the last 7 days, know what gets taken off the books from 7 days ago and what gets added tomorrow. You can do the math to figure out when we get to 524. And I believe, if my math is correct, it's 76 cases.
Correct. And we typically see our largest case counts on Monday and Tuesday after the weekend.
Is that just because of the backlog cases typically, or?
That's correct.
Okay. No, thank you, everyone. That's helpful.
Thank you, Steve. Tom Fitzgerald, good afternoon. The Fox 5 DC, and I believe you have questions for the county executive and also Dr. Bridges.
Yeah, both doctors if they want to weigh in, but thank you. County executive, I'll start with you. There was a pretty long debate yesterday about this mandate bill in the council. Your former colleague on the council, Mr. Raymer, had this to say that this is a quote, "I'm deeply disturbed the county executive is resorting to scare tactics about the impacts of a vaccination requirement rather than standing strong as mayors and governors are doing across the country." So I just wanted to ask you to respond to that directly. County executive, are you using scare tactics?
It's not a scare tactic. I didn't know what the answer was going to be to the question. I just asked the departments to tell us. My view was before I took a position, I wanted to know. That was the first question I asked. And my question is, I don't know how in the process of making a decision that could have an effect on public safety, one doesn't actually ask that question first and then develop a strategy that protects public safety. And I'm concerned, if we go the way of other jurisdictions where you get to use religious exemptions and you wind up with an astounding number of people now getting a religious exemption, we wind up with the exact same situation that people said they didn't want to get, but then they just get to wash their hands and say, yeah, this is victory. We did a mandate, we gave exemptions, and I got a whole bunch of people who aren't vaccinated delivering the services. It's like, let's figure out how to get a solution. I have never come out and said I'm opposed to mandates. I've tried to focus them on looking at these 3 departments and thinking about what you might do, which is frankly, if you're planning a strategy, better off done in a meeting where you're trying to talk with each other and talk out the problem than performing kabuki theater from the council stage. So anytime he wants to have a serious discussion about what are the consequences and what can we do to mitigate them, that would be nice.
You've all been pretty locked arms throughout this entire process here. Council President Hucker also had some things to say about a testing program that wasn't up and running to the way he'd like to see it. Dr. Stoddard had to answer those questions yesterday.
Yeah.
What is your relationship with the council right now? Are you still as unified together as you had been through this?
Well, I mean, you only see what what happens publicly. There
That's
are
why I'm
differences.
asking.
I mean, there are differences of opinion. I mean, when I proposed, the vaccine passport in a meeting with the council, Councilmember Reamer opposed it because of the Restaurant Association. And I'm like, so here's the one thing we know is the most likely source of transmission. And Dr. Stoddard can, comment on that. But if it's not number one, it's number two. And if it's not number one, the other one is retail. So the things we're allowing where people, particularly restaurants, where people can go in without masks and eat, because the Restaurant Association was concerned about it, he didn't want to do that. Folks are far more exposed in Montgomery County to restaurants than they are to police or firefighters. And if you're exposed to a firefighter, they're pretty much wearing a mask. And if you're exposed to somebody in our jail and you're a member of the public, you're actually never exposed to somebody in our jail. And that leaves the police. So, everybody's got things that they apparently think they should protect. And if people are going to play this silly game, we'll talk about, not caring about restaurants and the exposure of our residents there too.
If I could just turn to the doctors, there was some news out of the White House where I am right now regarding inoculations, coronavirus shots for 5 to 11-year-olds. Dr. Stoddard, I know you mentioned this in your remarks, but Dr. Bridges as well. How big of a game changer is this? And what will the county put in place to make these vaccinations available to these children?
So Dr. Stoddard, I'll start. So we've been planning for our 5 to 11-year-old vaccination activities since mid-July, realizing that mid to late fall, we will not only be administering 5 to 11-year-old vaccinations, but boosters as well. So we've changed our sites to accommodate larger throughputs. We began conversations early on with our community partners. We've had conversations with our pediatric providers and our hospitals and the Medical Society of Montgomery County to ensure that there was an interest, that pediatricians, and I think 70% of our pediatric population doctors responded that they would be interested and are interested and plan to administer those doses. And so as we quickly approach November and anticipate us having those vaccines available, we worked extensively with our Montgomery County public school partners, our private and independent school partners, as well as our community partners to look at strategies that would allow parents and their children, given the population, 5 to 11-year-olds, given the population to be able to access not only a vaccine, but make it fair and equitable. So we've looked at those spaces, we've used census data, we've identified those areas in the county where we have typically seen maybe some hesitancy at a family or an individual level. We've also looked at the census tract to ensure that those spaces that were identified, folks can walk up to them, they can bike to them, they can use public transportation to get to them. The only part, Tom, that we don't know and haven't received is the official guidance from the Maryland Department of Health. That guidance would also provide additional instructions for the types of clinicians, our access. We've reached out to Medical Reserve Corps. We've also reached out to those physicians who may not be vaccinating, but may also be willing to support our vaccination cause. So that's where we are in our planning process, and we hope that we can get started very soon.
Yeah, I would only add, so we've asked for the maximum 20,000 doses a week that we can ask for from the state of Maryland. And our goal is to get those 20,000 doses out per week to our 5 to 11-year-olds. When we talk about a game changer, I think it also bears in mind the county executive showed the 356 students in quarantine. When those students are vaccinated, they will not have to quarantine. So obviously that's a big game changer. So when we talk about keeping kids in school, in school education is the best place for them to be. That's why we're talking about implementing test to stay as quickly as possible so we can start that work. But obviously once vaccines are on board and they're fully vaccinated 2 weeks post second dose, or, then obviously that will, that will keep more kids in school, which I think there's universal agreement around that being the best setting for them to be in at this point. So, I think that's certainly where we see this as being a big game changer. And our goal is really to take, we're going to get up to 20,000. We don't know that we're going to get 20,000. That's what we've asked for, the maximum. If, whatever we get, we're going to try and give it out every week and be ready and waiting for that next allotment to do the same thing over and over again. And so we obviously been working with our pediatricians to get as many of them registered in as direct recipients of vaccine with the state as well, so that we can maximize the number of doses that are coming to the county. So that's our goal and what we're going to try and do for this effort.
Thank you.
Thank you, Tom. Next, Caitlin Peets, Bethesda Beat. Good afternoon, Caitlin.
Hey, good afternoon. Dr. Stoddard, you touched on test to stay, which I was planning to ask about anyway, so reading my mind. Maybe, I guess, just kind of expanding on what you said, I know it sounds like you're a little hesitant to talk timeline for implementation today, but if you're saying imminent, kind of to start rolling that out, does that then mean that you have secured the staffing and such that you need? And then can you just remind me if the plan is still to kind of start on a smaller scale with a handful of schools and then expand out from there?
Yeah, Kayla, we definitely don't have all the staff we need to fully build out as much as we would like. We're still recruiting staff through the contract agency that we're working with. We do believe this week, started really this week, we had hoped to have them in place last week, but few of them are ready last week than we had hoped. We've gotten a bigger contingent this week in place. And with that bigger contingent, we do feel pretty comfortable that we're going to be able to move forward with a we'll call it a pilot. And just to give you a sense of, and we've talked about this a little bit before, we're obviously going to try and target the larger quarantines so that with the resources that we do have, we'll able to reduce that number from 356 as much as we possibly can. The first week, it might only be reduced it by 50 or 100. I don't know. I don't want to, that's not we don't have a goal per se. We're going to take the number of teams that we have. If they're big quarantines, we're going to try and get those reduced. And then progressively, as more staff come on board, we'll have more teams to do the test to stay, and the pilot will naturally expand beyond that. So it's not like there's we're only going to start with 5 because we're committed to only seeing 5. If we have the resources to do 10 or whatever the number is, we'll do them, and then we'll add on to that as we get more staff onboarded and prepared to do testing. The key thing is that, number one, they're going to be doing the test to stay that we've talked about, but more importantly, they're going to be supporting the existing rapid testing that's happening in the schools. So in some cases, there will be teams that do test to stay in the morning, for example, and then they'll be deployed to schools to support the ongoing rapid testing that's happening for symptomatic students in the schools where there's been a high level of that. And then finally, those same teams will help us outside of school hours, typically be doing the vaccination efforts for 5 to 11. So this is a collective build to that. I don't know the total number. I don't know if Dr. Bridges, how many staff we're up to at this point, but it's something like 40 to 45. I don't.
Yeah, I thought it was around 48, Dr. Stoddard.
Okay, 48. So that's where we're at right now. And so obviously we've asked for at least I think up to 100, and we'll try and go from there as to whether we're going to try and get more based on how fast they can get that 100. So I think that's certainly, the 80 to 100 range is where we'd like to be ultimately, and that would help us to more fully build out the test to stay and the other testing and vaccination we want to do. But we've got enough now where we believe we can at least move forward with something pretty soon.
So if you have the 48, do you know at this point, like how many schools or locations that they could realistically support in this pilot?
I don't want to say it. I mean, we've been working very closely with MCPS, and sometimes I sometimes speak and before we talk to them. So I'm trying to be very conscientious of the fact that this is a partnership, and I want to talk to MCPS before I commit to any numbers.
Okay, thank you.
So Caitlin, as Dr. Stoddard said, we have our meeting tomorrow where we will actually talk about the test to stay and our other pediatric vaccination planning. And so just to look at those schools and identify those schools, again, we want them to be accessible and be able to not only identify those students, but have the staffing there that could be mobile.
Thank you.
Thank you, Caitlin. Coming up next, Jack Moore, WTOP. Good afternoon, Jack.
Good afternoon. This is for the county executive or Dr. Stoddard, whoever can best answer. I was hoping to get an update on the employee testing program, which kind of came out before the council yesterday. I understand that school testing has kind of been the priority, but can you give an update on where things stand with regular testing of unvaccinated county employees? And can you explain why, if an employee has made the decision not to be vaccinated, why it would be the county's responsibility to provide them a test?
A couple things. I would say we're very close to having tests or testing programs up running in both general county, but also in our public safety agencies. I promised the council I'd provide them an update on testing and implementation of the testing by the end of the week, and I intend to keep to that promise. We're working exhaustively today, tomorrow, and probably into the morning, certainly on Friday, to try and get as much information as we can ready for them in terms of launching the testing. So in terms of, so as to why we're providing it, obviously the county executive believes that testing is important, whether you're vaccinated or not. So obviously having testing available to the employees to make sure that they know their status, that they can protect the workforce, they can protect our residents, all those things. Vaccination is not a substitute for testing. You often will want to be tested even if you're vaccinated. I know, for example, I've got in my household, everyone's vaccinated except for my elementary school student, and we still have rapid tests available to us to try and test. If we're not feeling well, we have sniffles, we're going to go do an activity with family members, we often will test ourselves. And so I think it's a misnomer to suggest that we shouldn't be doing testing if people are fully vaccinated. Now, ultimately, at the end of the day, we're going to have some people who are not going to be vaccinated, whether we implement a mandate or not. And so we're going to want to have testing in place, whether we have a mandate or not. And so obviously we want to, our residents should want those people who, for a medical exemption, for example, are still being tested to protect them. If we're being genuine about wanting to protect our residents with a vaccine mandate, we should want to use testing to better leverage that mandate to cover those who can't be vaccinated for medical reasons. And so, I think it's just pretty straightforward that if we're being serious about protecting our workforce and being serious about protecting our residents, then testing should absolutely be part of that scheme, whether we implement a mandate or not.
And it's entirely possible that I may have missed something along the way, but it was my understanding that under the putting aside the vaccine mandate, that the council is considering, the current policy is vax or test by September 18th. So what's the testing that's happening right now?
So some of the testing didn't get stood up by September 18th. And I think that is what we're working on is, so corrections is currently doing testing, and there is other testing opportunities that are available. What we're trying to expand out is, frankly, we'd hope to have rapid tests in place, because rapid tests, in my view, and certainly the view of many public health scientists, are the best way to determine your status in real time. PCR tests are effective at telling you whether whether you have been or were recently infected by the virus, but it may not tell you actively infectious. And so we've preferred to focus on rapid testing as an option, but the availability of rapid tests has been problematic. The limited rapid tests that we had on hand, we actually pushed towards the school system early on to try and help them get stood up on their testing platform. And then obviously we've requested additional tests or tried to procure additional tests, and we're awaiting delivery of those. So in the interim, we're going to use PCR tests to try and bridge the gap, but PCR tests come with a lot more logistics challenges. And so we've chosen to use the limited personnel resources we have to focus on school-based testing, community testing, in lieu of doing the community testing as quickly as we had hoped to, or in lieu of doing the employee testing as quickly as we hope to. We're gonna stand up employee testing, as I said, and we're very close to being able to do it. But obviously, with a resource limited environment, we focused on places that we thought were going to be better. They're going to be more protective for our residents than simply focusing on all of our resources on our employees.
So I'll just add to that. When back in the end of August, beginning of September, when the school system was looking for testing and we were looking for rapid tests, we couldn't find any. They had pretty much literally disappeared from the market. We could get on waiting lists, but we no longer had the access that had been available before. And the state had a stockpile of tests reserved for schools, but that wasn't available to other uses as well. I'm a firm believer that if you're going to do testing on site, you need to really have the rapid test, because if it's a PCR test and you test positive once a week, there's no telling whether you've been exposed long enough if you have COVID to test positive on a PCR test. If you do test positive on a PCR test, that means you could have been spreading COVID to the people you've been working with for days. If there's going to be one test a week, you could be spreading COVID for 7 days before you're identified in the subsequent test with having been positive. So it's a problem to use the PCR test for the purposes that everybody thought they were going to be able to use it for. So we're pushing hard, and we've bought a lot of rapid tests that will be coming into Montgomery County. They're not here yet, but our procurement office worked really hard, and I had numerous conversations with them about the disappearing world of rapid tests.
Thank you. Thank you, Jack. Next question from Gigi Barnett, also WTOP. Good afternoon, Gigi.
Good afternoon. I wanted to do a follow-up really quickly on the Test to Stay program, Dr. Stoddard. I saw that it all hinges on parents giving the approval for their kids to be tested. How does the county respond to parents who say, I don't want my kid going through that much testing, number one, and number two, the quarantining is, they don't want their kids to be quarantined as well. They don't want either or. So the response to getting parents' consent and those parents who say they don't want either.
Well, so, you get choices in this world, and, if they choose not to participate in Test to Stay, that's certainly their right. They don't have to participate, but they also then don't get to decide whether they want to be quarantined or not, because it's not just their kids and their rights that are being considered. It's the rights and concerns of the other people who they may expose by virtue of quarantine in the school. And so, to me, I would say, I'm interested in keeping kids in schools. I'm also interested in keeping kids safe. We can keep more kids in schools by doing Test to Stay while also keeping them safe. If parents want to choose not to participate in that program, that is certainly their right, but then they can't. We've given them an option to keep their kid in school that we think is reasonable and frankly not invasive. And there's a lot of people advocating to suggest that rapid tests shouldn't actually be considered medical tests. They should be considered public health surveillance and shouldn't fall under the FDA. But the reality is they're relatively they're barely invasive in the sense that you stick a Q-tip half inch into your nose or quarter inch into your nose. It's really not that much to ask, but if the parents don't want to do it, then certainly this is a pilot. There will be other parents who are willing to do it while we have limited resources, and we'll keep their kids in schools, and the other kids can go quarantine. That's the perspective that we would have on it. Now, I know other jurisdictions have reduced their quarantines or eliminated them. That hasn't really been considered in Montgomery County. It certainly wouldn't be at this point, particularly if we have a Test to Stay option that's being brought on board. So that's the position that we've taken. Now, MCPS ultimately could choose to do something different from the Board of Education. And if they choose to do something different, that would obviously be their prerogative. But certainly that's not the guidance that Dr. Bridgers, myself, or anyone else has given them.
And Gigi, just to add, please keep in mind that our Test to Stay target population are those unvaccinated school-age kids. So not only do they put themselves at risk for transmission, but they put their family, their household contacts at risk as well. And so if a parent decides not to opt in or participate, that's just adding risk to that population by not participating in a program, as Dr. Stoddard indicated. Is to keep our school-age kids in the classroom and not have them at home, or even consider a quasi classroom or a virtual platform. So,
thank you.
Thank you, Gigi. Thank you, gentlemen. I do not see any more requests for questions from members of the media on the chat. Going once, going twice. All right, I guess we're done for today. Thank you, everybody, for joining us. Stay safe. Good afternoon. We'll see you soon.